Okay, so it's looking like this is probably going to be a regular filming venue for me. I have not been able to find time during my normal workday to record these things. So I had a patient talk to me about kind of like popping or cracking and whether or not to be concerned with pops, crackles, noises in joints in particular, but also with muscle attachments in the body. And generally speaking, if you don't have pain with a noise or a movement, that is not something to be worried about. When you pop a joint, then that just means that there is some amount of restriction at some point during that arc of range of motion, and you are forcing your way through that. And so we have kind of this spectrum of immobility to full fluid mobility. And at either end of that spectrum, you don't have any noise, no sharp movement, nothing that is sudden or even kind of crackly or gravelly in any of that. When we get those kinds of like noises, then or like twangs, if we're talking about like a tight muscle, then that is going to be somewhere between immobile and fully mobile. So it means that we are getting motion, which is good. And it means that we are experiencing some kind of restriction, which isn't great. We don't want that ideally, but it depends on where we are in our progress, right? So if we are going from some like really few very strong pops with limited mobility, and we are going to multiple pops or catches throughout the range of motion, then that is a positive sign because we are experiencing more noise, but more frequent noise, and ideally lower volume of noise or lower amplitude of the size of the movement. So we're having smaller movements or smaller catches that are happening more frequently throughout the range. So we are getting increased mobility with smaller restrictions, even if we experience them more often. Ideally, we will go to a point where we will have pretty free movement and then we'll experience some kind of crackles. And that's fine. That usually is a sign that we have some amount of restriction that is either building and we need more motion in that area, or that is just some restriction that we are working through and we are able to do that motion pretty well. That's a pretty good sign of progress. When you have a tight muscle, and I'm thinking like in the shoulder, pretty typically, you'll have like, we've got a small tendon that comes down right here. And if that muscle is really tight, and if you are moving your arm and you feel it kind of like twang over like some part, then that is what I usually use the visual image of like a speed bump. It depends on the tightness of the muscle and the velocity that you are making the motion. And so think of it like a tire going over a speed bump. If you have a flat tire and you move over the speed bump pretty quickly, then you're not really going to get much of a bump. And if you have a really inflated tire and it's really turgid, it's really stiff, and you go over the bump slowly, you're not going to get that jump. And so the same goes with this tight tendon over our bony process in our shoulder. If we have a tight muscle in the shoulder, which is pretty common, and if we move quickly, then it's going to jump. And it's going to make that twangy sensation. And that can lead to a like a tendonitis kind of thing, where if we do that multiple times, that repetitive agitation will be really agitating. It'll increase inflammation, it'll make some pain, and it'll make you sore. If you have tight muscle and if you go through that range of motion, that arc of motion slowly, then the muscle will be able to acclimate to the position change and the pressure change, and it'll be able to go over that bony landmark without jumping or twanging. And that is what I have my patients do if they really struggle with a tight muscle in any part of their anatomy. Then they need to slow down and do the motion that is troublesome for them. When our body experiences pain, it wants to tighten up. Tightening is a defensive measure by our body. It wants to create structure and it wants to protect the area. So it wants to kind of lock it down and make sure that no bad motion is going to happen to injure the tissue. So that's counterproductive to what we're trying to do. We need to make sure that it's freely moving without pain, and then work toward building strength and speed. So we need to slow down. We need to go through that painful arc of motion pain-free first. And if we can't do that with our own muscle, so if I'm raising my arm here and it is making that negative sensation, I need to work on going through that range of motion passively. And how we do that is by putting my arm up on a piece of furniture and then contorting my body to move through that range of motion without my muscles' involvement. Because then that will reduce the tension in the muscle, making it so that tire is flat and goes over the bump easier. That'll reduce that noise, that sensation. It'll reduce the pain. It'll not trigger the body's response to tighten up as a protective measure. I think that's all I wanted to say about that. Ask any questions. I'll be happy to do a follow-up.